Good afternoon, Durham. I'm Rod Jenkins, Director of the Durham County Department of Public Health. This week, we've received lots of questions about recent increases in COVID-19 cases in Durham County. So that will be the topic of today's video. First, I want to be sure you all are viewing accurate data. There are lots of sources out there, and some are less accurate than others. To be sure the data you're viewing is correct, visit our dashboard, which is shown on the screen. This data is updated once daily, so you can be sure it's up to date. Many of you have reviewed this data and are concerned about the large growth in cases recently, and you've asked for reasons behind the growth. A large number of these cases are attributed to increase in testing, as more testing locations have become available. We've also seen increases in cases among certain industries, particularly the construction industry. Many of you have also asked if these cases are concentrated in certain areas. Right now, we're seeing the greatest case growth in East Durham, particularly in the 27703 and 27704 zip codes. Remember, this information and more can be found on our Data Hub, and our weekly Reflections Data Brief on our Data Hub provides the story behind the numbers. Increased testing provides pertinent information about specific areas of COVID transmission that have been increasing. With this information, we have continued to work with community partners and coalitions in an effort to strategize ways to combat increases in cases. We also use testing as a part of our contact tracing in order to isolate and quarantine sick or exposed residents. Additionally, as increases in cases are largely associated with our Latinx population, we continue to focus our efforts on communicating with and providing information and resources to our Latinx community. I want to be clear, although increasing cases may be more concentrated in certain areas, industries, or among certain demographics, all of Durham is still susceptible to COVID-19. And even if you are not at high risk for death or serious illness from COVID-19, we have seen serious illness and death among residents of all ages and health histories. In fact, the average age range of COVID-19 cases in North Carolina is now between 25 to 49 years old, not over 65 like many people have assumed. Clearly, this pandemic is not over yet. As we continue to monitor and respond to trends in COVID cases, it is critical that you all continue to follow safer at home orders by staying home as much as possible. And most important, wear masks properly when you leave home. By following these two simple steps, we could greatly slow the spread of COVID in Durham. These times are scary as cases continue to increase. But at the health department, we continue to work around the clock to stop the spread. And we need you all to work alongside us by staying home. We can do this, Durham.